Obsessive compulsive disorder is another type of anxiety disorder. Here you have an individual who can either have A, obsessions alone, B, compulsions alone, or C, obsessions and compulsions, and C, of course, being the most common. Now, you need to understand what an obsession is. An obsession is a thought, which is repetitive, which is intrusive, which is senseless. So you are riddled with thoughts every single day, every waking hour of your day. You wake up, you have the thoughts. You try to read, the thought doesn't go away. You watch TV, the thought doesn't go away. And no matter what you do, you keep having these thoughts, which in reality, you don't want to have. So what do you think that does to your level of anxiety? What obsessions do is that they raise the level of anxiety. What kind of thoughts am I talking about? Thoughts of contamination where you think everything is dirty. Thoughts of doubt where you think that you've left things on and you continuously have to make sure you check them. Thoughts of guilt, aggression, or sex. But the most common thought is the thought of contamination. The second most common thought is the thought with doubt, where you believe that you've left something undone. You believe that you've left something turned on. So how does the brain control these thoughts? The only thing that the brain can do is that it comes up with a compulsion. And a compulsion is a ritual. And what that ritual does is that it controls the thought. This is something that we do. It's an act. It's something we perform in order to control the thought. Now these compulsions, these rituals are time-consuming. These rituals are repetitive. And what they do is that they lower the anxiety. For example, if you have thoughts of contamination, what would be the ritual that would make you feel better? You wash your hands. If you have thoughts of doubt, you think you left the stove on, what ritual would make you feel safe that the stove is on, or off, I should say? You go and you check. You also have thoughts of counting, of praying, and organizing. But again, the most common ritual will be the ritual of washing. The second most common ritual will be the ritual of checking. So in OCD, you have a patient that is ego-dystonic. They hate the fact that they have the disorder, and they hate the fact that they have to do these rituals. But you have obsessions followed by the rituals. And there you have the effect of the anxiety by the obsession being controlled by the rituals. Since obsessive compulsive is linked to serotonin, the treatment of choice, of course, will be the SSRIs. Now, OCD is seen in about 2% of the population. It is the only one of the anxiety disorders that has equal incidence in men and women. Again, it also occurs when you're relatively young, and it tends to be chronic. And as is true for all disorders, any kind of stress in your life will exacerbate these symptoms. Now, some of the associated problems that you typically find in OCD will be things like depression or substance abuse. Remember, patients who have anxiety are anxious, they worry all the time, they're fidgeting, they're restless, they're not sleeping, they can't concentrate. And what would make them feel better? And of course, what they always resort to will be substances. So they might use drugs, they might use alcohol in order to control the symptoms. And as far as the symptoms, they usually have good days and bad days, so the symptoms will usually wax and wane. Now, as far as the treatment of obsessive compulsive disorder, you're deciding whether to use behavioral modification or pharmacotherapy. Remember that OCD is directly linked to problems in serotonin. So the treatment of choice for OCD is not so much behavioral therapy, but pharmacotherapy. And there you would use an SSRI. If you were to use a TCA, the one that you would probably use would be clomipramine, only because it's the most serotonergic. But if given the use of both of these drugs, they're both efficacious. However, SSRIs are safer than the TCAs, so the SSRIs would be most indicated. If we're going to use behavioral therapy for the treatment of OCD, then we can use something called exposure and response prevention. You could also use relaxation techniques, deep breathing exercises, etc. But what is unique about the exposure and response prevention is that they expose you to your fear. For example, if you have a fear of contamination, they expose you to dirt. And what do they not let you do? They don't let you wash. And eventually, over time, you realize, you know what, I'm dirty, I stink, this is disgusting, but this is not going to kill me. And that's what you hope you will learn from this type of technique. If they ever make you choose between behavioral and pharmacotherapy, for OCD, the treatment of choice will always be SSRIs instead of behavioral therapy. But ideally, both of them should be used.